Evan Smith was a 21-year-old with a bright future ahead of him, a huge sports fan, a football analyst who loved his mum's baking. But today his mother and father were at the inquest into his untimely death to hear a coroner tell them that it could have been prevented.
We are beginning to get answers to what really happened, and it's sad to think that he didn't get the optimal care he needed. Nothing brings our son back.
Evan died at North Middlesex Hospital in April 2019 after developing sepsis. He suffered with sickle cell disease and even rang 999 from his hospital bed after nurses refused him oxygen. In court, that care was criticised. The coroner concluded that a delay to Evan's blood transfusion was the cause of his death and that medical staff failed to identify the severity of his symptoms because of a lack of understanding about sickle cell disease. Had that procedure taken place sooner, then it is likely Evan Smith would not have died when he did. In response, the hospital trust said, "We carried out a thorough internal investigation into Mr. Smith's care and treatment, and we recognise that this should have been better. Since then, we have made a range of improvements, including a specialist sickle cell area and extra training for staff. But that is little consolation for the loss of their only child."
I've been robbed of, everything I can say, because his absence and is so visible in the house.
I hope no other patient will have to go through that.
And they shouldn't. The life of this young, energetic man ended where he should have been looked after properly. Lucy Watson, ITV News.